Worried about dermal filler migration and how it can affect your results? In today's video, we're going to discuss one of the biggest concerns clients have when considering dermal filler treatments: filler migration. We're going to discuss in detail what it is, how it happens, and what we can do to prevent it. Let's get into it. I'm Dr. Haroon, a cosmetic doctor based in the UK with over half a decade of experience and nearly 10,000 cosmetic treatments under my belt. Almost on a daily basis, I'm asked questions about dermal filler migration. This is when dermal filler moves from the area it was initially injected to another area, usually leading to unnatural or suboptimal results. Dermal filler isn't going to move from your chin to your under eye area, but even half a centimeter of migration can lead to unflattering results. The most common area for filler migration is in the lips, and when filler begins to move outside of the lips, it can ruin the definition and give the appearance of a ledge, as you can see here. The reason why filler migrates can be broken down into three main categories: practitioner factors, product factors, and patient factors. Let's look at each one of these in detail. Firstly, and arguably the most important, is practitioner factors. The skill and techniques used by your practitioner play a crucial role in the success of your dermal filler treatment and its likelihood of migration. Correct and appropriate injection technique for the proposed treatment is essential. The depth and placement of the product will determine how the filler integrates and settles over time. And I wouldn't be doing my job if I didn't mention that the original Russian lip technique increases the chance of filler migration. This technique involves multiple vertical injections outside of the lip into the lip, with the aim of increasing the height of the lips. The issue with this is that the needle path would leave a tract for the filler to move from inside of the lip to outside of the lip, hence filler migration would occur. Top tip, always inject within the red of the lip to minimize this from happening. Choosing the right product for the area being treated is also the responsibility of the practitioner. You have to use the right density of product for the area being treated. Soft, flexible products for mobile areas such as the lips and the smile lines. Thick, rigid products for less mobile areas such as the cheeks, nose, and chin. Therefore, using a thick product in the lips can lead to migration over time due to the constant movement, as the inelastic filler is unable to adapt to ongoing pressure. And lastly, the practitioner should avoid overfilling any area of the face. It's tempting to think that more is better. However, if you overfill any compartment of the face, it can lead to migration, as excess product can leak from its original area to neighboring areas. Even if the patient is requesting more filler, it's the responsibility of the practitioner to refuse treatment if it's going to lead to overfilling. Next up, let's discuss product factors. Simply put, cheaper and lower quality dermal fillers tend to migrate more because they do not integrate well with facial tissues. Not only do these lower grade products have a higher chance of migrating, but they're also more likely to cause lumps, nodules, and unnatural appearances. Premium brands of dermal fillers are more likely to integrate with the tissues and have been shown to be more stable over time. Not only are you more likely to end up with a more aesthetically pleasing result, but the chance of migration also reduces dramatically simply by using high quality dermal fillers. So the next time you're wondering how a practitioner can charge £100 for lip filler, you should know that they are either making a loss and using high quality filler, or they are using budget, low quality dermal filler, dramatically increasing the chances of filler migration. And the last factor is patient factors. This is what you as a patient can do, and more importantly not do, to reduce the risk of filler migration occurring. Following the aftercare instructions is crucial after dermal filler treatment. Patients should avoid putting excessive pressure on the treated areas to prevent the filler from moving from its original placement. Additionally, practitioners should not routinely advise the patients to massage treated areas, as this can also lead to filler migration. Patients should also avoid strenuous exercise and heat exposure following the treatment. Put simply, heat and exercise can cause the filler to move and spread before it has had the chance to integrate within your tissues. And that's it. These are the main factors that influence whether filler migration occurs. Migration is a major concern that many patients have, but just to give you some reassurance, amongst trained practitioners, it's a very rare occurrence. In my experience, I've not seen dermal filler migration occur when the correct technique is used, coupled with premium dermal filler products, and assuming the patient has followed the aftercare correctly. I hope you found this video helpful, and if you have any questions about non-surgical aesthetic treatments, please get in touch. Thanks for watching. Bye now.